My name is Sunil Verma. I work as a family-focused recovery coordinator for Southwest Sydney Local Health District, and the objective of the role is to ensure that we have a child and family sensitive practice in our mental health service. And I think one of the big concepts I gained during my 16 years of experience in mental health was it is so universal, it is indiscriminatory, no matter if you are rich or poor, you are religious, what religion you belong to, what culture, it still equally affects every individual's and that was pretty profound for me. Growing up, I had a lot of health issues. So what it has done was it affected my well-being in terms of mentally, causing me anxieties and depression, and I started to isolate myself. And slowly during my high school, that's when I started knowing more about what's happening, and with knowing with other friends who were struggling with the same challenges, which made me feel that I'm not the only one. And then their support, and then the family started to understand what I was going through, their support. Everything started to make me feel like I'm okay, I can do better, and that helped me to understand mental health and see that how I can help people who are struggling with the same journey. In my early stages of my practice, I really struggled with separating myself from my work, because any caring job is very consuming. It drains you down and it captures you so much. I started to become very mechanical. I couldn't see people as people. I started seeing them as illnesses, which really hit me hard, that what am I doing? And that's when I started to separate myself from being that mechanical person to a person who can be a compassionate, caring, and understand a person beyond their illness. So I started put things in place for me. Luckily, in my culture, I was exposed to a lot of good practices of yoga, meditation, which really helped me to rethink about those cultural practices that was in my family. It also helped me to reflect, because one thing you have to understand that if you are struggling yourself, you cannot help anyone. And that's a clear story, like why the lifeguards, even though they are good swimmers, they need to have a buoy to help somebody who is drowning, otherwise they will drag you down. It's the same principle that we all health professionals, doctors, nurses, allied health, anybody who works as a carers, families, and other caring members should put those things in practice. I actively started working out, even though a small half an hour to 45 minutes of workout at the gym. I go for a retreat once a year, a 10-day meditation retreat. I call it meditation boot camp. These things really help me to get myself centered and be more efficient in things that I do. Many a times it is hard for an individual who is suffering from mental health issues to accept that they are struggling with mental health because of the stigma attached to it. So it is very important for them to understand that it's okay and I can get better. And as a community, we have to support those individuals in terms of giving them that hope, and being very non-judgmental about it. Southwest Sydney is a very multicultural community. There are a lot of communities who doesn't want to talk about mental health. So involving those community champions to talk about it, and having professionals coming and having a talk about that, and giving that hope that there is nothing to be ashamed of. So that is something that we can work it out. So mental well-being is putting those things in place to care for yourself in a way that you can support not only yourself, your colleagues, your family members, your kids, and your community in a bigger way. For us, there is a general statewide mental health access line, which is 1-800-011-511. Any individuals can call that number and seek help for their loved ones, for themselves, for anyone that they care for.